Well, good morning, everyone. As we sit here today, it's hard to believe as it is to say, I think, that it's the one-year anniversary of Dr. Morrison's first COVID briefing in our province. This time last year, I think it's safe to say that most of us hardly knew what COVID-19 was. We had probably never heard of the coronavirus. And we absolutely had no idea how disruptive it would be, how it would impact our lives. So I guess what a difference a year makes. You know, a year ago, it was almost a case of what we didn't know and what we couldn't do. We didn't have the ability to test for the virus in our own province. We had absolutely no idea how long and how fast and how impactful the days, weeks, and months that were ahead of us would be because of this unknown virus. But I'm happy to say that here we are a year later. We know much more. We've been through a lot, and we're the better for it. And we sit today ready to roll out a province-wide immunization program where every adult in our province will be able to receive a vaccine before Canada Day. I can honestly say that although we continue to see cases of COVID-19 in our province, and I want to again stress that we're not through this yet, we're in a much better place today than we were 1 year ago. And just before I turn it over to Dr. Morrison and Nurse Dowling for our weekly briefing, I did want to recognize a significant moment yesterday. I was meeting in the cabinet room with Dr. Morrison, with Marion Dowling, with Aaron Bentley, with Jillian McDowell, and Denise Lewis-Fleming on the rollout of our immunization clinics within this province. And it was not lost on me that yesterday, March 8th, was International Women's Day, and just how grateful I was and how fortunate our province is to have such strong women at the forefront of our response to COVID for the last year, and also to be, you know, on the front of this as we make our next stages through this journey to immunize those in our province. I think, you know, I can say from having seen it every day that they have led us with strength, with courage, and with expertise, and with confidence, and that has meant the world to me, and I think it's meant the world to Islanders. I just thought it was important to recognize their expert leadership throughout this, and we'll need to continue to rely on that expert leadership as we make our way to the next part of this journey. So with that, Dr. Morrison, I'll turn it over to you and Marion.
Thank you, Premier. Good morning. Today, there are no new cases of COVID-19 to report. We currently have 28 active cases, and that is the highest number of active cases in the province since the pandemic began a year ago. And for the first time in the last year, there are actually more active cases in P.E.I. than in Nova Scotia. I do remain concerned about our current COVID-19 situation. The provincial lab has received the results of genetic sequencing of our recent cases. These results confirm the cluster of cases in Summerside and Charlottetown are linked, and they basically have the same genetic fingerprint. But fortunately, it is not a variant of concern. One of our other travel-related cases from last week was confirmed as the variant B.1.1.7, originally identified in the United Kingdom. To date, we've had a total of 4 cases associated with a variant of concern. All are B.1.1.7. Last week, I spoke about the vaccine rollout. Over 80% of the eligible population in P.E.I. over the age of 16 will be able to get at least 1 dose of vaccine by the end of June. The interval for the mRNA vaccines will be extended for all new appointments in order to maximize the number of individuals who can receive at least 1 dose. We know that 2 weeks after the first dose, individuals have very good immunity, and that lasts. However, a second dose or booster is needed to maintain that immunity. This is great news about the vaccine supply, and we get more good news almost weekly now about our vaccine supply in P.E.I. We've been advised to plan for a substantial increase in vaccine arriving in P.E.I. in the coming weeks. All of these doses will be administered to Islanders and those who live here. For example, between this week and mid-April, we expect to receive over 30,000 doses of the 3 approved vaccines. Pfizer, the Moderna product, as well as AstraZeneca. These additional doses will allow us to offer more people their first COVID-19 immunizations at the end of March and in April. And during these next few weeks, we'll be contacting one partner in care for each of the long-term care and community care residents in P.E.I. in order to book their vaccine appointments. We'll be offering vaccine to border screening staff. We'll be immunizing more healthcare workers and others in high-risk areas. I know police, firefighters, and other utility workers will also be contacted for their appointments. As well, appointments will be booked for individuals who are over 70 years of age, beginning with those over 75 years of age. And beginning on Thursday, Islanders over the age of 75 will begin to be able to schedule their appointments by calling toll-free number or booking online or making an online request for a callback. And I know Marion will provide more details of exactly how that's going to happen as part of the provincial vaccine rollout. I will note that we will have a limited supply of the recently approved AstraZeneca vaccine. The 2,000 doses of this vaccine will be administered by 6 pharmacies across the province to individuals age 18 to 29 years of age who have a P.E.I. health card and who work in the food and beverage service and in the in-food service delivery areas. And we do hope to receive another 6,000 doses of AstraZeneca in the coming weeks. So beginning again on Thursday, March 11th, individuals who are in those categories 18 to 29 who work in the food and beverage service and food service delivery, the intention is that they will be able to book an appointment as well at a pharmacy in their area by visiting princeedwardisland.ca/getthevaccine. To the thousands of Islanders who have stepped up and responded enthusiastically to the opportunity to receive their COVID-19 immunization, thank you. These individuals chose to be vaccinated for their own personal and professional reasons. And I think you'll see more of a campaign get launched today and in the days ahead. We have seniors who did it for their grandchildren, long-term care staff who did it to protect residents, paramedics who did it to protect their patients and also residents of P.E.I., members of the COVID response team and other frontline providers who did it to work together and because they trust science, and leaders who did it to protect their communities. And I know when it comes to my turn to get vaccinated, I will be doing it for my mother, my family, and for all Islanders. Next week is March break, a time when some families traditionally do special activities both on and off the island. At this point, although we can't say for sure that we'll be out of the circuit breaker measures, the next few days will be key in determining if we need to extend the circuit breaker or if the measures can be eased. There will be an announcement by the end of the week regarding the circuit breaker measures. Regardless of what measures are in place, I encourage island families to keep March break activities small. This is not the time for large organized or personal gatherings. I'm hoping children and families can enjoy outdoor activities and exploring new areas of our community and our province, whether it's skating, hiking, snowshoeing, sledding. For families who decide to treat themselves to a night or two at a local hotel, please keep any gatherings small and try to keep that 6 feet of physical distance between you and those from outside your household. We really don't want to let our guard down right now. We know that COVID-19 moves when we move and that personal gatherings have resulted in significant transmission of the virus. So for March break activities, think fun and safe. This week marks the 1-year anniversary of the World Health Organization declaring a global pandemic. On March 11th, 2020, the WHO declared a pandemic, and at that time there were over 118,000 cases and 4,000 deaths worldwide, while Canada was reporting 103 cases of COVID-19. And although it was early days in the pandemic, the WHO recognized that one of the groups at highest risk of severe outcomes from COVID-19 were older adults. 1 year later, there are over 117 million cases and 2.6 million deaths worldwide. The virus has had a devastating impact in some countries. In Canada, there have been over 890,000 cases and over 22,200 deaths. Yesterday marked the one-year anniversary of the first COVID-19 related death in Canada. And while we report on deaths and cases, each of these numbers is a person. Each death represents a significant loss for their family and friends. As we mark this anniversary, our sympathy goes out to all families who lost a loved one to COVID-19. As the Premier mentioned, I gave the first live stream briefing on COVID exactly a year ago today on March 9th. And it was the beginning of a week we all remember very well. And some of what we announced during those first briefings sounds quite familiar. A year ago today, we recommended that anyone returning to P.E.I. from outside of Canada to monitor for symptoms of COVID-19, avoid large gatherings, and refrain from visiting the elderly or anyone with pre-existing medical conditions for 14 days. Everyone was asked to practice good hand hygiene, cough etiquette, and avoid touching their face. At that time, we recognized the need to increase our testing capacity as our tests were all sent off-island for analysis to either Moncton or Winnipeg. On March 13th of last year, we recommended that Islanders cancel non-essential travel outside Canada and that anyone returning from international travel should self-isolate for 14 days. Also, residents of P.E.I. were asked to reconsider attending social events where they could not maintain a physical distance of 2 meters. And on March 14th, our first case of COVID-19 was announced, a woman in her 50s who had returned from travel on a cruise ship. Like the rest of the province, we remember that first case. And I think we were all nervous and anxious about what would lie ahead with COVID-19. We did not know much about the virus and managing this type of pandemic. But we did know it was going to be different and difficult, and I don't think we could have anticipated how long it would last. On March 16th, the Premier declared a state of public health emergency that remains in place today. And from the outset, our game plan was simple. As much as possible, keep COVID-19 out of the province, and when there are cases, to work hard to contain the virus and limit transmission. And I thought I'd mention a few statistics which really highlight some of what has been accomplished in the last year. Almost 20,000 households have completed 14 days of self-isolation. Since April, 247,000 non-commercial vehicles entered P.E.I. via the Confederation Bridge and Wood Islands Ferry, transporting over 500,000 individuals. And almost all of these individuals were screened at the point of entry. 1,000 individuals have now registered with our office as commercial truck drivers, and 940 people have been approved as rotational workers. 2,400 applications were approved under the Family Connections program, and over 1,500 students were approved to travel to P.E.I. Almost 29,000 calls were received on our 1-800 line. 760 temporary foreign workers entered P.E.I. and completed their 14 days of self-isolation. Justice and Public Safety have received 601 complaints, attended 723 residences and 6 businesses, issued 200 warnings and 117 charges, with 4 charges pending. In addition, they have done 1,077 random self-isolation checks. 111,265 COVID-19 tests were completed, and P.E.I. ranks 4th in Canada in testing per capita. We have managed outbreaks and 143 cases of COVID-19, and there's 777 close contacts. And remarkably, we have not had any hospitalizations or deaths. And we have done this together. As I reflected on the past year, one of my children, I thought, put it very well. The year went by quickly, but some of the days were really, really long, Mama. And I would agree. Living through a global pandemic has a profound impact on us all. We will always remember where we were and what we were doing when we heard about the first case of COVID-19 in P.E.I. We'll also remember what we did on the last normal day before COVID-19. 1 year later, we can be very proud of how we have come together as a province to manage and live with COVID-19. We have all witnessed the generosity, kindness, resilience, patience, and creativity of Islanders during this past year. The pandemic has demonstrated why this province and our people are so special. I thank everyone in P.E.I. for their continued and unwavering support of the public health measures and for sticking with it and following the rules even when it is so difficult. The high level of our individual compliance is why our province has done so well. I asked some of my team about their reflections on the last few months, and I heard a number of comments which I'll share. We have developed new partnerships with others in government, the private and non-private sector. We would not be where we are today without our many partners and teamwork. The pandemic has brought new meaning to the concepts of pride in our work, collaboration, and working together. And one person said, "I've never worked so long and hard and been so tired, and I am ready for COVID-19 to be over." I am proud of our small team. We are like the little engine that could. I am proud of how well Islanders are coping with COVID-19. And I've learned so much. And I said to them this morning, I am so fiercely proud of the team, our partners who are too many to mention, and I am proud of Islanders. And you should all be proud of yourselves. As I've said before, there is more of the road behind us than ahead of us. The arrival of safe and accessible vaccines much sooner than expected is reason for optimism and signals that we will get this pandemic under control and life will get back to normal for us. After reflecting on the last year, I think there's one word that comes to mind, and we've mentioned it a couple times, it's hope. And we need to remind ourselves of what we're hopeful for in the days to come. Hopeful that we were able to get the current outbreak under control and ease out of the circuit breaker measures. Hope that we can get through this pandemic without any serious illness, hospitalizations, or deaths in this province. We are hopeful that in the spring, our Atlantic bubble will reopen. We are hopeful that more families will welcome loved ones who live away to come home to P.E.I. this summer. We can be hopeful that everyone over the age of 16 will be immunized by the end of June and have their second dose over the summer. And we can be hopeful that our case numbers drop soon, not just here, but across the country, and that we can look forward to a better summer in P.E.I. We came together initially by staying apart. We have worked together through this last year. We are coming through this together, and we will get through this together. So as we see the finish line ahead for COVID-19, let us continue to be patient and let us continue to be kind. Thank you.
Thank you. It has been a year. And as Dr. Morrison said, we at Health P.E.I. remain concerned about the level of COVID-19 in this province currently. We must all remain diligent in our practices and in following public health measures to keep everyone safe and limit the spread within the community with this ongoing outbreak and the linked cases. At the same time, there is good news about our vaccine supply coming to P.E.I. and moving forward more quickly with our vaccine rollout. Everyone working on this COVID-19 response is looking forward to providing these vaccines to the people of our province. So now, with more vaccine arriving in the last weeks of March and the first 2 weeks of April than we were expecting, we're changing appointments booked already for people who are aged 80 years and older, who have appointments booked between April 19th and April 27th. Those aged 80 and older who have appointments booked between April 19th and 27th will be booked automatically into a new appointment on March 30th, so they will receive their vaccine sooner than expected. People in this group whose appointments are being moved will receive an automated notification by phone from our online booking system. And if you have any questions about your appointment which has been moved, you can call our 1-844 number, which is 1-844-975-3303. If you're aged 80 and older and had an appointment booked between the April 19th and 27th, and you do not receive a notification about a change to your appointment within the next few days, please call that 1-844 number to confirm your appointment date and time. Today, I'm also very happy to announce the launch of our next cohort of immunizations for individuals aged 75 to 79. On Thursday, March 11th, people aged 75 years of age or older will be able to begin booking their vaccination appointments based on their birth month. So individuals aged 75 or older, born in the months of January through April, can start booking your appointments this Thursday, March 11th. Those aged 75 and older, born in the months of May through August, may start booking your appointments next Monday, March 15th. Those aged 75 and older, born between September through December, may start booking your appointments next Thursday, March 18th. Appointments for this age group will be available starting the week of April 5th, and we hope to be able to accommodate all of this age group before the middle of April. Appointments can be booked directly by using our online booking system, by calling 1-844-975-3303, which is our booking line, and speaking to our clerks, or by filling out and submitting an online web form, which is available on the princeedwardisland.com/getthevaccine website. They will receive a call back to book their appointment if you submit that form. We also continue to book additional frontline healthcare workers, registered rotational workers and truck drivers, our partners in care, and other previously identified groups. Confirmed locations for our vaccine clinics are in O'Leary, Summerside, Charlottetown, and Montague, and plans are being made to add an additional clinic in the Surrey area starting in April, and we will continue to monitor the needs in other communities based on our population and vaccine logistics. As Dr. Morrison has mentioned, that due to the ability for us to now extend the second dose to a 16-week duration, some groups who were originally scheduled for their second dose in March within that 28-day interval will have their second doses rescheduled to the longer interval. Those individuals in the 80 years of age and older cohort who had previously scheduled their second dose appointments, your second dose appointments will not change. Any newly scheduled appointments, so for this group of 75 and older that will be booked, will have their second dose at that 16-week interval. I wanted to just note that as of last Thursday, with the end of the modified red phase, the visitor restrictions at all health P.E.I. facilities had returned to our previous protocols. Patients may now have visitors while in hospital, as well as up to 3 designated partners in care. Visitors and partners in care must continue to follow public health and infection control guidelines. Visitors must wear a mask, wash your hands, and physically distance from staff and the patient they're visiting. Our partners in care are able to have physical contact with the patient that they support in their care. Unfortunately, at this time, we cannot allow visitors or partners in care to eat or drink within our patient rooms or hospitals at this time. We know that removing a mask to eat or drink is a known way that the virus may spread. Due to good public health measures and compliance, we have been able to allow most visiting in the recent months, and these measures are required to ensure this continues. I want to thank everyone as well for your ongoing patience and understanding and kindness and attention to the public health measures over this past year. We all look forward to when it's our turn, when it's my turn to be vaccinated. And I also want to thank Islanders for your eagerness to be vaccinated. With that support and the ongoing leadership with Dr. Morrison and the Premier and our teams, we are getting through this, and we will see the end of this together. Thank you.
Thank you. Thank you both for, I think, important messages here today. And just, as I say, for the last year, through all the ups and downs and the stress along the way, thank you both for your hard work. And please pass on to your teams, how grateful we all are as Islanders for their work. So with that, I will turn things over to some questions from our friends in the media.
Steve Bruce, CBC.
Yes, good afternoon to you all. A question for Dr. Morrison. We've had a number of these recent cases where people first tested negative and then they later came back positive after showing symptoms. I'm wondering, does that at all call into question the accuracy or the value of asymptomatic testing? And then in these public exposure cases, you've been telling people to self-isolate just until they get one negative result. So are you rethinking that approach at all, given what we've seen happen?
Hi, Steve. So actually, I think almost all our cases, have tested negative the first time, but they're considered close contacts. And I think that it's worth clarifying. People who've been at a public exposure site and who we say, you don't need to isolate for 14 days, watch for symptoms or wait for the first test. There's a risk assessment done. They've had been wearing a mask. They've been only in a location for a short period of time, so the risk is considered very much lower. And now, but if someone is named as a close contact, they've had either a higher risk exposure, longer period of time, interacted in a different way, and for those individuals, they're named as close contacts. And I think it reinforces some of these last cases why we keep people, in isolation for that period of time, because they may feel fine after their first test, but if they are considered a close contact, that they need to still stay in isolation in case their next test is positive or they develop symptoms. Having said that, there's always a chance, and this is why we are doing so much testing around that even at any point in time, if a test is negative on one day, whether it's an exposure site or not, that a week later you have new symptoms or different symptoms, then you should be tested, because a negative test last week doesn't mean that you're going to stay negative. And so I think we did, as we've pointed out, Steve, a huge amount of testing. We have a large number of people who are close contacts in isolation, and they're there because they were identified as having higher risk because of the type of exposure they had. So I appreciate the question, because I think it's a good chance to clarify that.
Thanks. And you mentioned you're starting to schedule 18 to 29-year-olds to get the AstraZeneca vaccine who work in the food service industry. Can you talk about, I guess, why you selected that specific age group and why that specific industry? To our understanding, the doses arriving here of the AstraZeneca vaccine will expire in about a month. So does that put an added pressure on you to get those doses out quickly?
So we have 2,000 doses of AstraZeneca that actually arrived in the province this morning into the provincial pharmacy. And yes, they don't have a long shelf life in terms of expiry doses, but we only have a certain number of doses. We have over, I think it's last I checked, it was 69% of our cases are in the 20 to 29-year-old young person category, and a number of our outbreaks have been related to young people in certain industries who may have worked in certain industries in this province. So that is why we have made that decision based on our epidemiology and the number of doses. As we sort of talked about before, there are other groups that we may want to identify with that AstraZeneca as we get more vaccine. We anticipate more AstraZeneca in April and then also again in May. So we'll be able to closely monitor how many doses and who else we may be able to vaccinate with the AstraZeneca as well. I think this is such a really good news that we are basically getting more of our Pfizer vaccine coming in sooner than we thought, and our Moderna vaccine is going to start to increase as well significantly in the weeks ahead. So I think I mentioned we'll have done we'll be able to deliver as much vaccine in the month of April as we have received between the middle of December and the end of March. So basically, that's how much we're going to be able extra to do in 1 month in April.
All right, thanks so much.
Great, thanks.
Louise Martin, CBC.
Hi, good afternoon to all three of you. I'll start with you, Dr. Morrison, and again, it's on vaccines and the increase, as you mentioned, means the province can move more quickly with vaccine rollout. I didn't hear any mention of Johnson & Johnson, which was approved last week. Is there any update on when P.E.I. might receive doses of the Johnson & Johnson vaccine, which is a one-shot vaccine, and what that could then mean to P.E.I.'s rollout?
So thank you, Louise. Hi. So the Johnson & Johnson product was approved on Friday, and as you mentioned, it's a one-dose vaccine. We don't have any numbers confirmed for Prince Edward Island or when it would arrive, but we would be adding that vaccine to the vaccine that's anticipated here, and we'll let you know any confirmed amount and date about as we know it.
And I understand that Nova Scotia is planning to vaccinate its temporary foreign workers when they arrive in that province to help with the agriculture sector. Is P.E.I. considering doing that, and where do farmers actually fit in the vaccination rollout?
So we have identified essential workers who have contact with the public, and as one of the groups over the next couple of months, and I think hopefully we'll be starting in May. So that is part of the answer. And temporary foreign workers, if they're working, for instance, in a fish processing plant, will be actually reaching out to fish processing plants and doing everyone at the fish processing plant, and that would include temporary foreign workers, either who are still here or who will be coming. And so those will be, they'll be vaccinated with others as they fit into the rollout here in the province.
Sorry, did you say farmers would be considered essential workers potentially starting in May? I'm sorry if I misunderstood that.
Yeah, I mean, they'd be essential workers if they have interaction with the public.
Understood. Thank you so much.
Yes.
Rachel Collier, The Graphic.
Hey there. Steve kind of asked the question I was thinking of right off the bat. But I guess just to carry on with that train of thought, some people had wondered, why there might be a bit of a discrepancy between rotational workers who need to be tested 3 times after exiting the province compared to those who might have been exposed to COVID who only had to get that one test and then they were kind of free to go. I don't know if you'd be able to elaborate on that.
Sure. Hi, Rachel. I think it is related to Steve's question earlier that it's about risk. Our rotational workers have been outside the province sometimes for different periods of time. So they are traveling. They have worked elsewhere, often where there are increased numbers of cases and outbreaks, and especially as we're watching the variants of concern increase in the percentage of cases that are seen across the province. So it's quite different after perhaps working in another location for a month and coming back versus walking through quickly in a grocery store with your mask on. So it is about a risk assessment, and so that is again, good to clarify that. It's about the length of time, it's about the type of exposure, and the nature of that exposure. So I think that's that helps explain it. I know that it's really challenging for rotational workers who have been getting tested so often and trying to protect their families and the community as they work and come back and forth. And we've really tried to have modifications to that isolation to keep everybody safe. And I will mention that rotational workers and truck drivers are really prioritized as important people to be get immunized. And once they're immunized, a couple weeks after they get immunized, certainly there'll be further information on our ability to adjust their isolation. The testing may still be a requirement, but they won't have to isolate, is our hope, in the same way. So there'll be further information about that as they get vaccinated.
Okay, and I guess just as a follow-up, since I have the chance, is there any modeling or any kind of statistics that would tell you guys how many people you might expect to see this happen with based on our situation, or is that just kind of too many factors and too far-fetched to come up with a number?
Rachel, I'm modeling on how many people will be vaccinated. I'm sorry, I may have missed part of the question.
How many people might have tested negative and then a few days later test positive based on our recent kind of the people who were exposed or potentially exposed?
Well,
yeah.
Well, that information, of course, not only is being looked at here in our province, but right across the country. And one of the things we know about coronavirus, and it is something we actually have known for quite a long time, is that after exposure, people will sort of test positive or have symptoms from basically 2 days up to 13 days. And that's why that period of 14 days has been talked about so often and so much. So that's why it is not uncommon for people to test negative the first time and get a positive test the second time. I just think we had so many cases in a smaller period of time with so many people as close contacts identified. We heard about it more last week than may have otherwise been the case. But that has happened across the country right throughout the pandemic. And one of the things that we talk about with the variant, they tend to test positive really quickly and show symptoms a little bit faster with the variants of concern. We talk about that transmissibility and how quickly people get symptoms. But most COVID cases really present at some point during that 14 days.
Great, thanks so much.
Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. La question est pour Dr. Morrison. J'aimerais savoir qu'est-ce que ça prendrait concrètement comme situation pour que vous recommandiez l'ouverture de la bulle atlantique à nouveau. Qu'est-ce que vous voudriez voir avant?
Bonjour, et peut-être le Premier ministre peut répondre aussi, mais pour moi et puis pour mes collègues à Nouveau-Brunswick et à Nouvelle-Écosse, pour certains, on aimerait que l'incidence des cas de COVID-19 est aussi bas que possible et on sait que les cas sont liés au voyage ou les autres cas qui sont liés. Alors, c'est l'épidémiologie qui est important, mais aussi qu'on a des groupes de personnes qui sont vaccinées. Maintenant qu'on a les personnes qui sont plus âgées, qui sont vaccinées, on a plus, c'est une bonne chose et parce que c'est dans ces groupes qu'on a plus de personnes qui sont mortes dans le pays. Alors, on doit essayer plutôt que possible que ces groupes sont vaccinés. Mais je pense que ça va arriver le printemps et le Premier ministre mentionne le printemps aussi. Alors, c'est des indications comme ça qu'on aimerait voir.
Merci. So my follow-up is actually for the Premier. Nova Scotia Premier said that there's going to be a meeting next week to discuss the Atlantic bubble. Okay, what can you tell us about these discussions and what are you going to be pushing for?
Well, thank you very much for the question. I did speak yesterday to Premier Rankin about a number of things, one of them being, the bubble and what the spring looks like. We both agreed that we needed to have a conversation with Premier Higgs as well to just discuss what that can look like. We'll obviously take our advice from the chief public health officers in each province. I think Dr. Morrison alluded previously that they've had a conversation. We continue to target, mid-April for the reopening of the maritime or Atlantic bubble. I have been, committed from the beginning that as soon as this is safe to do so, I would like to open to our sister provinces to begin. This is an unnatural state we find ourselves in now for a full year, where we're restricting people coming to this province. That's not who we are. That's not what we're about. And that's not what we want to be about going forward. So as we vaccinate more and more Islanders and Atlantic Canadians and Canadians, I expect to be able to relax some of those restrictions that are in place. But we'll only do that when it's safe to do so under the advice of Dr. Morrison and her colleagues.
Thank you.
Thank you.
Gabrielle Trimont, Radio-Canada.
Good afternoon to you all. Ma question, c'est en français pour la docteure Red Morrison. Docteur Morrison, vous avez répondu ça en anglais, mais j'aimerais que vous me répondiez en français. Vous avez annoncé que les personnes âgées de 18 ans à 29 ans qui travaillent dans l'industrie alimentaire vont pouvoir se faire vacciner avec les doses du vaccin AstraZeneca. Ça va être distribué dans les pharmacies. Ma question, c'est pourquoi faire vacciner ce groupe de personnes maintenant? Pourquoi le vaccin AstraZeneca? Et comment cette décision a été prise?
Bonjour, Gabrielle. Alors, on a seulement 2000 doses d'AstraZeneca et on est en train de vacciner toutes sortes d'autres groupes avec plein de vaccins qui commencent à arriver. Mais on a aussi ce groupe de personnes, c'est le plus grand nombre de personnes qui ont eu COVID-19 qui sont vraiment âgés, juste entre 20 et 30 ans vraiment. Et puis, ils sont la plupart de notre outbreak ici à l'île du Prince-Édouard sont liés en manière avec l'industrie alimentaire. Alors, c'est pour cette raison et on a l'épidémiologie qui supporte cette décision, mais on sait et on va ajouter les groupes quand on n'a plus de vaccins qui arrivent ici, mais beaucoup d'attention vraiment sur les personnes qu'on vient d'annoncer, 75 ans et plus, qui vont commencer à faire un temps pour être vaccinés en même temps.
Et ma prochaine question, mon follow-up, c'est justement à ce sujet. Pour ce qui est des prochaines phases de vaccination, vous avez dit que vous allez recevoir dans les prochaines semaines plus des doses des 3 vaccins qu'on a actuellement, qui sont autorisés par Santé Canada. Bientôt, peut-être, on aura un vaccin Johnson & Johnson, mais vous ne savez pas exactement quand est-ce que ça va arriver. Mais on a quand même 4 vaccins qui ont été autorisés par Santé Canada. Comment allez-vous définir qui va recevoir quel type de vaccin dans les prochaines semaines, dans les prochaines phases de vaccination?
Alors, on ne sait pas encore quand ou combien de doses on va avoir pour le Johnson & Johnson. Alors, c'est difficile à dire à ce moment. Mais on sait, en total, on va avoir 100 000 doses de vaccins entre vraiment maintenant et la fin de juin. Et puis, ils sont tous les vaccins qui sont bons. Et ils sont tous approuvés par Santé Canada. Alors, c'est n'importe quel vaccin est un bon vaccin. Mais pour l'instant, AstraZeneca, c'est seulement recommandé pour les personnes qui sont moins de 64 ans d'âge. Alors, on ne peut pas donner AstraZeneca pour les personnes qui sont 70. Alors, ça dépend des indications pour le vaccin, mais on veut que tout le monde soit vacciné. Et puis, en 3 mois, on devrait avoir la majorité des personnes qui sont sous 16 ans et plus vaccinées ici à l'île du Prince-Édouard avec leur première dose. Alors, c'est vraiment le but. Et si tout le monde peut être vacciné, ça va changer la manière qu'on peut vraiment vivre et d'être ensemble.
Parfait. Merci beaucoup. Bonne journée.
Bonne journée.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'avais une question aussi sur le fait que des gens ont été testés négatifs puis positifs, comme mes collègues du CBC. Il y a plusieurs semaines, on avait évoqué l'idée de réduire la période d'auto-isolement. Il y avait des essais qui étaient faits, des études. Est-ce que le fait que les gens soient testés négatifs puis positifs, ça vous retient ou ça vous inquiète de réduire la durée d'auto-isolement?
Bonjour Laurent. Alors, je sais qu'on a parlé de réduire la période d'être isolé, mais la majorité des personnes vont être positives entre 10 jours, mais on a encore des personnes qui sont un peu plus tard que ça. Alors, c'est pas qu'on ne discute pas ça encore, mais je pense qu'on met plus d'attention sur le vaccin, alors on ne doit pas isoler du tout, serait idéal, mais c'est peut-être quelque chose qu'on va continuer d'en parler, en particulier avec les personnes qui sont peut-être pas vaccinées, mais c'est vraiment une discussion qui continue.
Merci. Et j'avais aussi une question sur, vous avez fait un grand retour sur l'année qui vient de se passer. À l'île du Prince-Édouard, 0 hospitalisation, 0 décès. C'est contraire aux statistiques. Est-ce que c'est juste de la chance? Est-ce qu'il y a des études qui sont faites pour expliquer pourquoi ici on n'a pas de malades graves? Comment on peut expliquer cette situation?
Je pense que c'est beaucoup de travail et puis on a limité l'importation de COVID-19. On a, comme j'ai mentionné, je pense qu'en anglais et en français, qu'on a la majorité des cas sont les personnes qui sont moins de 60 ans. Alors, ils sont... Alors, ils ne sont pas aussi... la possibilité d'être à l'hôpital, c'est un peu moins. Alors, c'est les raisons comme ça. Alors, mais j'espère que ça va continuer pour les 3 mois qui suivent pour qu'on puisse vacciner tout le monde.
Merci beaucoup. Bonne journée.
Bonne journée.
Jennifer Bassa, CTV Atlantic.
Hello, good afternoon. So my question was actually answered a couple of minutes ago, but I just wanted to kind of follow up regarding the Atlantic bubble. So I was curious, if variant cases continue to pop up, will that affect the decision to enter back into the Atlantic bubble?
Hi. So I think a good chance for me to maybe I think I answered part of my question about the Atlantic bubble in French. So, when we're discussing maritime bubble, Atlantic bubble, and I know that's on everyone's mind as we go into the spring, I mean, we'll be looking at the epidemiology in terms of the cases, and not only the number of cases, but whether they are linked to travel or whether they can be linked and managed within our respective provinces. And that would include the variant. We know there are cases, we've had 4 cases of variants of concern in this province, and I know they've been identified in our neighboring provinces as well. And I think if they're managed well and, we also have to make sure people isolate the way they're supposed to and get tested, then I think that is going to be a really important part of moving into a maritime bubble or Atlantic bubble. And also, as we go forward the next few weeks, we're going to be able to vaccinate a lot more people in certain vulnerable groups, and I think all our provinces are going ahead and trying to do as many of those groups as we can in the next few weeks, so that we can really epidemiology being stable and not having any big large outbreaks could make us consider having that discussion with the premiers. I know having that conversation soon.
Okay, thank you very much.
You're welcome.
Dave Stewart, The Guardian.
Good afternoon to you all. I guess my first question would be in regards to the cases over the past week. My numbers may be wrong, but 6 perhaps yesterday put us over that mark. But the fact that they all tested negative initially, are we getting false negatives due to rapid testing? And I apologize if that ground was covered, but I thought I'd ask it.
Yeah, no, hi, Dave. So actually all the initial negative tests were actually on PCR tests. So they were not initial negative rapid tests. They were PCR-based tests, and then they were repeated.
Great, thank you.
Yeah.
And of course, we're all looking at Sunday the 14th to see if the circuit breaker lifts, and you just alluded to that in your comments. What factors, Dr. Morrison, are you looking at in terms of whether things will change on Sunday or Monday?
So I think not only the people at this table, but across the province are really hopeful that we can ease up on these circuit breaker measures. I think we're looking at it every day, looking at the cases and whether they're linked or not linked. I mean, really what we were trying to make sure does not happen, and that we don't start to see these unlinked cases in our community that we can't really tie into this outbreak. And so that's certainly a big factor of it. And I think we're hoping, as I mentioned, that we'll have more comfort with every passing day, and that by the end of the week we'll be able to make a decision. And I mean, our epidemiologist is having conversations with her and the team on a daily basis, as I know this is of interest to everyone.
Terrific. Thanks very much, guys. Appreciate it.
You're welcome. Thanks.
Thanks, Dave. And I guess it would be remiss if I didn't say a huge thank you to all of you in the media. This has been an interesting run for all of you as well. We've changed the way we've done a lot of things in terms of our interactions, but I do want to thank all of you for how you have adapted and for continuing to share this message with Islanders. So thank you for all your efforts as well. So
Much appreciated on behalf of all of us.
Thanks.